Westchester County closed a $197.7 million budget gap this year. It cut 8% from nearly every department and eliminated 180 positions. And the state budget that was supposed to stabilize things just missed its deadline for the 7th year in a row. Here is what all of that actually means for the services you depend on. This is the Westchester Brief. I'm Jim. Let's get into it. When County Executive Ken Jenkins signed the 2026 budget in December, the headline was The Gap, $197.7 million, the largest structural deficit Westchester has faced in modern history. Every county department absorbed an 8% cut. 180 positions were eliminated. Contracts and outside expenses were reduced by $34.5 million. What the headlines did not tell you is what survived. Jenkins maintained funding for childcare, affordable housing, mental health services, food security, domestic violence resources, and first responder support. That means the 8% came disproportionately from everything else: parks maintenance, administrative capacity, contract services to nonprofits. The county says no workers were laid off and that all positions were eliminated through attrition. But when a caseworker retires and the position is frozen, the caseload does not shrink. It gets absorbed by the people who remain. Now layer in what is happening above the county. New York State missed its April 1st budget deadline for the 7th consecutive year. Lawmakers passed a one-week extender that expires today. Albany is deadlocked over auto insurance reform, changes to the climate law, school aid formulas, and taxes on high earners. Until a budget passes, school districts cannot finalize their own spending plans, and the essential plan is approaching a July 1st cliff. Here is the essential plan number that matters most. 450,000 New Yorkers will lose coverage on July 1st unless the state acts. The federal government eliminated funding for the expanded tier covering individuals earning between 200 and 250% of the federal poverty level. Those residents currently pay $0 in premiums. Starting July 1st, marketplace alternatives could cost up to $250 per month with a $2,500 deductible. Westchester has an estimated 100,000 residents enrolled. This is what 3 levels of fiscal pressure look like converging on the same residents at the same time. A county budget built on austerity, a state budget that does not exist, and a federal funding cut that eliminates health coverage for the people who can least afford to lose it. Here is what else is happening across Westchester this week. Sustainable Westchester's request to extend the deadline for its annual report was denied by the Public Service Commission because it was submitted after the deadline. The organization says a replacement clean energy program is coming, but no timeline or municipalities have been confirmed. Mamaroneck is proposing to end free Sunday parking at meters. A public hearing is scheduled for April 13th. Business owners along Mamaroneck Avenue have raised concerns about the impact on weekend foot traffic. Westchester Medical Center's Brenda Fareri Pavilion, a $220 million critical care tower in Valhalla, remains on track for a 2026 opening. The facility will house 128 private ICU-capable rooms and the Hudson Valley's only comprehensive stroke center. That is your Westchester Brief for Tuesday, April 7th. Subscribe on YouTube for the video version of every episode. I'm Jim, and I live here. I'll see you tomorrow.